Doctors of Reddit, what is your worst case of I googled my symptoms? I had a grade school kid tell me he had a brain tumor. Turns out he put a dried bean in his ear and forgot about it. Serious answer, I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings, and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says, "I think I have caught the Down syndrome," or when a young woman thought she had testicular cancer. I'm not a doctor, but I did take my very elderly Nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my Nana is a major hypochondriac, and when she was admitted, the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. Actually, I'm a doctor, but this story is from medical school. I had a patient who correctly diagnosed herself with mastitis, although she was very worried that she had inflammatory carcinoma of the breasts. To be fair, they can look similar. Another time, I had a patient correctly diagnose a lump in her breast as a fibroadenoma. I was very impressed. Not a doctor, but when my fiancé said he was having chest pains and when he breathed, it crackled, I googled, and all of the symptoms lead to serious illnesses such as collapsed lung. Thought nothing of it, diagnosed it ourselves as an allergy and didn't go to a doctor till later in the day. It was in fact a fully deflated collapsed lung. Not a doctor, but worked at a hospital for a while. One of our doctors came back to the nurse's station laughing because someone was fully convinced they were diabetic because they were craving water, and WebMD said that makes them diabetic. Turns out they are just human and require it to live. I had a UTI, because I had the symptoms and googled it. Day of doctor appointment, it was just a regular checkup. But I asked for a UTI test since I explained how I was feeling. Convo went like this. Could it be possible to request a UTI testing? I've been feeling the symptoms of burning when I pee and some discomfort dash. How do you feel now? Any pain? Well, no, not at the dash. Well, if you did have a UTI, the symptoms wouldn't go away, you are fine. 2 or so days later I get a full-blown kidney infection from who would have guessed, a UTI. Sent out a complaint, fuck that bitch doctor. I always ask for a test if I am suspicious of anything, and I have them documented if they say no from now on. That was a horrible experience. Not a doctor, but in 2013 I was feeling awful. Shaking, puking/dry heaving, shaking, excruciating and debilitating pain. Went to the ER, had blood work done that I never knew what it said, and the doctor told me it was a gallbladder attack, gave me pain meds and sent me home. 3 days later I was even worse. Couldn't eat, couldn't sleep. The only relief I felt was when I was in scalding hot bath. I finally went back to the ER and they did more blood work and told me my gallbladder was septic and my pancreatic enzymes were 6,500 and rising. They should have only been 100 to 150, and I was dying. I was admitted, and when they did my gallbladder removal, my gallbladder was solid black and had 80 stones and a tar-like substance from sepsis. Come to find out the first time I went to the ER my enzymes were 2000, I should never have been allowed to leave the hospital. Ever since we studied multiple sclerosis in neuro, I'm convinced I have it, despite my only symptom being paresthesias, funny feels, in my legs at night. Not a doctor, but my friend once said a guy came with a backache and wanted to get operated cause he thought he had kidney failure. This confuses the fuck out of me. When I go to a doctor they specifically ask if I've done research about whatever, like they expect it. Awkward position cause if I have researched I feel like an idiot using Dr. Google and having medical student syndrome. If I haven't researched I get the distinct impression nice disappointed the doc. I went to a doctor one time and he Googled my question in front of me. Not a doctor but I was having horrible debilitating headaches for a while, Googled my symptoms and they ranged from stress to brain cancer. Ended up being sinusitis. Not a doctor but I deal with migraines. I would not be surprised if someone experienced a migraine for the first time, Googled their symptoms while they still had the clarity to do so, and went to the ER thinking they are having a stroke. Paramedic student here. Last week we had a call for an imminent delivery. PT started having abdominal pain that would last a little bit and stop. And about 2 to 3 minutes later would start again. She Googled her symptoms and everything she found was saying she was in labor. She called her husband and he told her to call 911. We walked in as the baby was crowning. She had no idea she was pregnant. Not a doctor, nor was my brother despite him thinking his Google foo is a degree, but a couple years ago my brother decided that since I had been laid off and needed to borrow some money from him to tide me over that it meant that I was utterly depressed and suicidal. Thus, he deduced that I needed to be institutionalized and took me to a doctor. He lied and said he wanted me to just get a normal checkup since I hadn't had one in a while. I was, I believe, rightly pissed off and embarrassed, but since I needed the money I went along with it. So he decides to just come into the psychiatrist's office with me while she is trying to ask me some questions and see how I am. He starts throwing out terms like maladaptive coping and how I am suicidal and needed treatment. She finally tells him to leave and I speak with her for a bit. Now I was a bit morose because I had lost my job and was embarrassed about asking for help, but I wasn't suicidal and the psychiatrist agreed, stating that I just needed support and not Google foo quackery. I hadn't turned to drugs, stealing, or any other illegal or destruction activities to deal with my depression, just that I was a bit withdrawn and down because of my recent low. TLDR, laid off, needed some financial help. Brother Googled big sounding words and tried to act like a doctor to an actual doctor. No longer interact with that clown and my mental health is quite improved because of it. I'm not a doctor, but I'm a medical assistant and I room patients for the doctor. This is in the occupational health field, and we had a young gentleman come in who was pretty sure he had a groin hernia according to his Google search. He said he'd been lifting produce crates and experienced sharp, overwhelming pain in his groin. The doctor came back out after seeing him and was clearly fighting laughter by the time he got to the desk. Turns out the kid had chlamydia, which had caused things to become swollen and just happened to get symptomatic while he was at work. Not really related to this topic, but I am a medical student. And recently got sty in my eye. Sty is usually self-diagnosable, but I called up my cousin who is a doctor just to confirm. Anyways, when I was telling this incident to one of my friends, he started scolding me, saying as a medical professional, I should set the example of going to the doctor and getting proper medicines and treatment, and all I could say was, dude, I'm becoming a doc, I know how doctors are. Doctors, especially when they know you're a medical student, tend to overdiagnose or pretend as if we have medical student syndrome. But anyways, got the meds and my eyes healing, beaming face with smiling eyes. Not a doctor, but once back in 4th grade, during winter break, I had some sort of illness that made me throw up, sleepy all the time, and a few other symptoms I can't remember. So I was at my mom's computer, and I decided to Google my symptoms since my mom wasn't there. Turns out I had mono, or also referred to as the kissing disease. So after that, I was crying to my mom, hacking my guts out, while my mom tried to calm me down. And to this day, legend has it, I still don't know what I had, and I have never had it again. Took my 92-year-old grandma to ER because it was Saturday. Told them I suspected UTI. Doc didn't listen. Finally she had to go potty and they brought a potty chair in. After she was through, the nurse went to empty it. She took one look at how her urine looked and went out and almost made the doc write order for test. Of course it came back as UTI. It can be difficult to diagnose a dementia patient because they lose ability to tell doc what's going on. They also become afraid of doctors because they think they will put them in a nursing home or such. At the hospital in my town there was a kid who came in saying he had knee pains. The doctor said it was from playing basketball, and 5 months later at a different hospital they found that he had knee cancer and it was too late to treat him. He died a few weeks later. Really sad story. I had 2 separate doctors tell me that I was having panic attacks, when in fact I was having simple partial seizures caused by a Lyme-sized cancerous tumor in my brain. I got so much Xanax though. Not a doctor, but throughout my childhood and teen years I had these weird episodes where I would suddenly have really bad déjà vu and get very nauseous. For the next few hours afterward I would feel like I was in a fog and my memory would be shit. Eventually I googled my symptoms and learned they might be minor epileptic seizures. I went to a doctor and he laughed it off and told me it was probably just having panic attacks related to the normal emotions of being a teenager. I was so sure he was wrong that I opted to go get an EEG. Turns out I have a mild form of epilepsy and Google was totally right. A guy thought he had a hole in his heart, turned out to be a polo mint in his top pocket. Not a doctor, but the brother of the patient, and worst being on the money. My older sister diagnosed herself as having symptoms of systematic heart failure. Her new primary doctor agreed and gave her some basic guidelines of what to do, and had her visit her cardiologist. The cardiologist pooh-poohed her, saying there was probably nothing to worry about and scheduled a test in a few days just to be on the safe side. One of the things her primary had her looking out for was sudden weight gain, and when she woke up 2 days later suddenly 6 pounds heavier, we went straight to the emergency room, who ran tests, including an echocardiogram. Her injection fraction was 12, and they immediately sent her to the biggest hospital in the area, where they ended up saving her life from congestive heart failure. She had had at least 2 silent heart attacks due to the amount of damage they found. TLDR, I still have my sister because she self-diagnosed correctly. If you know how to do a proper search on the internet, and discern bullshit from truth, you can actually get pretty far. I helped my doctor diagnose my issues by providing him the information I'd found from people similarly experiencing my condition. Without my searching, the doctor would have just sent me home with antibiotics, again. Not a doctor. I had an insect bite basically next to my nipple. It was itching like crazy, and my usual bite cream said not to be used on nipples, so I decided to Google what else I could do to relieve it. Found out that apparently no one else has ever had an insect bite on their nipple, but that what looks like an insect bite on or right next to your nipple is almost certainly inflammatory breast cancer. Phoned up my GP. We used to be neighbors, so I kind of knew him, and was in a right state because I thought I had this incredibly aggressive form of breast cancer. He listened to me for a minute, asked a couple of questions and then said, "It's an insect bite. Come back to me if it's still there in 3 weeks. Oh, and try deodorant on it." The deodorant calmed it right down, and it had gone by about 5 days afterwards. Midwife here, or at least I will be in 2 months when I graduate. Google has its place. It helps people be more informed if you take what you read with a grain of salt and listen to your healthcare provider. Had a young lady last week who thought she might have preeclampsia because she'd Googled it, and based on her symptoms she was absolutely right to come in. We were surprised when the tests came back negative. But she was also very anxious about getting it, so I was clear to her that she shouldn't go home and Google it more because it would just make her anxious. I also always try to give people appropriate websites to go to, so at least that can Google something evidence-based. Obligatory, not a doctor. I was the patient. I Googled my symptoms of hearing loss, tinnitus, vertigo, eye focus issues and headaches. I was fairly convinced I had an acoustic neuroma, a rare benign, but if not treated potentially life-threatening, tumor on the 8th cranial nerve. The aunt was convinced it was sinus-related, but sent me for an MRI on the very slight chance there was something else going on. At this point I mentioned that I had read about the aforementioned tumor and she looked to be stifling an eye roll. It's always a brain tumor when we Google our symptoms, right? The morning after my MRI I received a call from the aunt and she sounded shook. Not only did I have the tumor, it was as big as a golf ball and pushing against my brainstem. I Googled my symptoms. Turns out I have internet connection problems. Had the opposite experience with my general doctor. He was sure I just had social anxiety. Finally went to a psychiatrist at age 28. Diagnosed autism. Still I felt like it probably was only social anxiety after years of my doctor denying it. Went to another psychiatrist. Autism again. Turns out my general doctor thought autism means can't understand metaphors and symbolism and Sheldon Cooper likeness. Not a doctor, but I had a co-worker come into the office with this one. He was having nausea, fatigue, frequent urination, and decided to WebMD that shit. We're chatting in the office one day and he says something like, "Yeah, I've been feeling like shit lately, and it sounds like gestational diabetes, but I can't find any cases of men getting it." I just slowly lowered my head into my hand and asked him, "Do you even know what gestational means?" He did not. Obligatory, not a doctor but the patient. Went to the doc several times as a teen complaining of being extremely lethargic. I slept like 13 hours a day, extremely pale, cold all the damn time, etc. All classic signs of anemia from what I had looked up. but the doctor said I was overreacting and just being a teenager and refused to even check. Well, guess who ends up back at the doctor's like a year later after an emergency blood test showed my hemoglobin was at like 6.2. Just being a teenager, my ass. I googled my symptoms and found out that I'm dead. Not a doctor, but I spent 3 months in dread because I thought I had bad herpes on my face and groin. Turns out it was psoriasis. Kinda sucks sometimes, but thank God it's not contagious. Long story short, I used to be in a relationship with a highly anxious hypochondriac. There were many spells of OMG I'm dying that were laughable. Things would calm down, life was good. One time, for a handful of symptoms, headache, neck ache, general sick feeling, she mentioned I think I have meningitis. Normally, it was just the process of calming her down, etc. etc. This time I thought, I'll Google that. Off things went. I bought into it. One long embarrassing call to the CDC later, there was nothing wrong. I figured they would know for sure, beats me what I was thinking. Another expensive as hell trip to the doctor confirmed that nothing was wrong. That was embarrassing as hell, and about $200 in a wasted trip to urgent care. Student nurse here picked up a shift in the emergency department as a healthcare assistant. Completed a triage of a 19-year-old student. On a Monday. Said she suffered abdo pain and vomiting the Sunday morning. I said what brought her in today. She said, well, Google said so. I was like, okay. I told the practitioners and the leading triage. Said student, then proceeded to tell the nurse she vomiting after getting home from night out, she'd only been home a couple of hours. Apparently she hadn't realized alcohol could make you vomit. Poor girl. A lifetime of drinking and she didn't really vomiting was a symptom of drinking, she had a lot to learn. Google didn't exist, but the internet did. I was positive my problems were caused from multiple sclerosis by my past symptoms and internet searches and medical books. This was back in early 90s. I was told the reason I couldn't walk on my leg was all in my head. It wasn't until 1994 when I lost my vision and had an MRI that the lesions were first discovered. Then I was told I had a demyelinating disorder and would probably have no other problems with it for the rest of my life. I researched demyelinating diseases and only 2 showed up: MS or Lou Gehrig's. I was terrified to say the least. Again, 2 years later I went numb from my chest to my feet on my right side and had electric shocks, El Hermit's sign, when I bent my head down that I finally got diagnosed with multiple sclerosis. Not a doctor. When I talk to doctors I say Google told me blah blah blah, is that accurate? Usually helps establish that I've tried to do research but trust them more than Google. Ironically, if it weren't for Google I don't know what I would do, as I live in a country with bad health care. I've been self-diagnosing for 7 years now. The latest thing I found by myself is gallbladder problems, since no one was paying attention to my complaints. I went and did some blood tests after Googling for info, and about 80% of the tests I ran were off the charts, so naturally went to a gastroenterologist and they're like, well, you gotta remove the gallbladder. The irony of having to pay a bunch of money for a gallbladder surgery, having in mind all my life I've been made fun for being a picky eater, being skinny, and the fact that my cholesterol is actually low. I'm not a doctor, but I went to a doctor because I was certain I had delayed sleep phase disorder. He It told me I couldn't have a sleeping disorder without being depressed and made me take a depression test. It said I wasn't depressed, so he said obviously I don't have a sleeping disorder. I went to a sleep specialist a few months later and they diagnosed me with delayed sleep phase disorder and helped me get it under control. Not the worst, but I found out I had VPH thanks to Google. Went to a gynecologist with my girlfriend so she could get tested, and indeed, it was. Thankfully it's not one of the cancerous types as we had also guessed, but it was scary nonetheless. Not a doctor, but I am currently in med school. When I was about 12 years old, I felt a painless lump inside my nipple. I thought this was something of low importance, so I continued to live my life. A few days later, when I was in the shower, I felt another painless lump inside my other nipple. I thought this was weird, so I decided to Google my symptoms. I thought about male breast cancer, and I knew it was a low chance of me having it, but I decided to look up some signs of the cancer. And there it was, in my exact words. Symptoms of breast cancer include a painless lump in the breast. I was terrified. I informed my parents, and I was in tears. I didn't know what my future would look like, and this thought shook me even more. Would I ever become a doctor? I then searched for treatments of breast cancer on Google, and it said the only treatment was to amputate the breast. I was even more torn. The next day my mom showed me an article about my breast cancer, and it turns out that I was just going through puberty, and this was completely normal. To this day, my family and I still laugh about the incident. I Google a rash that my daughter had and I got it right. I always Google my symptoms and have only been wrong once. Sort of. I thought I had gastroparesis. I know that my stomach was not emptying. I could feel it. The DR said I couldn't have that because there is usually a reason to have that, and I didn't have any of those things. But I didn't care. He gave me a wonder pill that made me feel all better after 6 weeks of constant nausea and vomiting and being unable to eat. The healthcare system where I live is broken. Someone I know didn't have a doctor, had been looking for one for 7 years, and started having worrisome symptoms. The ER and clinics wouldn't order tests because follow-up appointments would be needed, and they didn't do that. She finally went to an ER and stood her ground, saying she wasn't leaving until they did tests. Google suggested she had a brain tumor or a hyperactive thyroid. They reluctantly did the tests and she had to fight for the follow-up. Turns out it was a thyroid disorder, for which she was in bad need of treatment. Without Google, she didn't have much ammunition for the fight. I once thought I had mono for an entire year. And #X200B. Turns out I was just really bored. And #X200B. Wayne's World. I went to the doctor the other day because I self-diagnosed myself with HPV, cervical cancer, and bacterial vaginosis. I don't have any of these. Legit thought my clit was cancer. I had some strange symptoms a few years ago and went to urgent care a few times with little success. I used Google and it suggested I had heart failure. After a few more days of struggling to breathe at night, I went to the emergency room and yup, I have heart failure. I Googled my symptoms. I think I'm pregnant. You're a 58-year-old male.